Well, my connection starts really with that first phone call that I make to the patient. We're a national service, so we get referrals from consultants, respiratory physicians all over New Zealand. And I would make that phone call explaining to the patient that we've received the referral and we would like to see them up here in Auckland. It may well be just for a preliminary review where we just meet the patient, run a few tests, or it may be that we do the full assessment when we first meet the patients. And it's important, I feel, to develop a rapport with them even over the phone. So I like to develop a rapport, make them feel at ease, because obviously this is pretty scary for them. Coming up here, while they may be frightened, they also come up here with high hopes that there can be some treatment option to improve their failing health. So the process of accepting a donor lungs comes about by a call coming to us from Organ Donation New Zealand, where they are referring donor lungs to us. First of all, we have to make the decision in consultation with the respiratory physicians and surgeons, are these lungs suitable to be used? And if the answer to that question is yes, have we got a suitable recipient that those lungs could go into? Because often, well not often, but sometimes we do get referred donor organs where we're unable to use them, even though they're very good quality organs, and that's because we haven't got a suitable recipient. So we have to ensure that we've got recipients of the same blood group. The lungs are going to fit into that recipient, so there has to be a size issue that comes into it. And then if we've decided yes, we do want to take those organs, and yes, we have got suitable recipients, so the process begins. And we have to, I have to speak to all members of our teams, so the surgeons obviously are involved early on, talk to the intensivists, the anaesthetists, and we usually have a meeting with our surgeons, anaesthetists, intensivists, respiratory physicians to start this process going, to ensure that we have the right recipients. And if we've got 2 or more recipients of the same blood group and same size that could benefit from those lungs, we then look at who is the sickest patient. So who might not survive to receive a transplant, and that could be the person who's been waiting the least amount of time, who's going to receive those organs ahead of somebody who's been waiting for 6 months or 9 months. Great. There can be logistical problems for us. Weather can play a big part in getting our recipients and also up to Auckland, because obviously everybody's got to come up to Auckland Hospital, and also getting our donor team, our retrieval team, to go and retrieve these organs. So we could possibly have to get a recipient up from Christchurch, and we may be sending a team to Dunedin. We always use private aircraft for our team to travel in, our retrieval team. And if it's after flying hours, then we have to get the recipients up as well. So if it's sort of 10 o'clock, 11 o'clock at night, it can be a bit of a logistical nightmare to ensure there's enough private aircraft, of course, available. What is happening with the weather, and that has caught us out in times before. And also what's happening at our hospital. This is a very busy hospital where there are lots of acute operations. And so when a transplant occurs, we have to utilise many members of our team, surgical members of our team. And so our surgeons, while we do have a surgeon on call, but if we're doing a heart and a lung transplant, then we're relying on another surgeon or surgeons being available when they're not on call to come in and to perform the transplant. Last year was a big year for us. In fact, the biggest number of lung transplants performed in the history of our service, where we performed 19 lung transplants last year. And I think the numbers for the donor referrals to organ donation, I think, were pretty static, as they have been over the last few years. But what has changed is that we were able to utilise the organs that we've been offered. And to be able to do that, you need to have people on your waiting list. So if you've only got 4 or 5 people on your waiting list, it's pretty obvious that you are not going to do many transplants because you haven't got the people to transplant. As where if you have greater than 10 or 12 people on your waiting list, it's highly likely that you may have all of the blood groups covered, so that even the rarer blood group patients may be on the waiting list, and you will be able to use those organs that have been offered. There are times when we get referrals and perhaps we deem the organs to be marginal, so we couldn't quite use them as they look at the time of referral. However, we are able to employ the services of our intensive care doctors and also the organ donation intensivists to see if those organs can be improved so that they are suitable for transplantation. It's imperative that patients do come and live here for a period after their transplant, and the reason for that is that the transplant coordinators and the doctors need to ensure that we are monitoring the patients very closely. We're monitoring them for infection and rejection. We all have to be very vigilant. This is also a time where we continue to educate the patients about their new medication regime. So all of these patients have been commenced at the time of their operation on anti-rejection medicines, so it's important that we continue to educate them about their medicines, the possible side effects of those medicines. The patients are reviewed very closely by the respiratory physicians. They attend a weekly clinic here on the Green Lane site, and we continue, as I said, to monitor very closely for infection and rejection. We monitor for rejection with surveillance bronchoscopies and obviously monitoring for infection at the same time. We've got 24 beds here. We've been in our new premises here in Harty Towers for 2.5 years, which is fantastic. We and the patients love being here. Though I'd have to say, with the numbers that the numbers of patients that we are seeing, really 24 beds isn't enough most of the time. Unfortunately, I have got some beds in the staff residence here on the Green Lane site which I can use, and also use the local motels nearby for patients. Even Auckland patients will live here in Harty Towers for a period of usually 6 weeks. Sometimes we can get them home a little bit earlier than that. And patients from other areas of the country will be here for a period of 6 to 8 weeks on average. Some patients have to stay a little bit longer. I've just sent a patient home today, 6 weeks post her lung transplant, down to the bottom of the South Island, in fact. So she's done very well. There are other patients who may be in hospital for a period of 6 to 8 to 10 weeks. So no one patient is ever the same in transplantation.